Hi, good morning everyone. I am Rahul Nanuhal, COO at Cureka.com. Today we are back with our weekly Instagram live session with a specialist doctor to take care of your health concerns. First of all, to all the doctors in the world, very happy Doctors' Day. It's a pleasure and an honor to work with such dedicated doctors who take care of our health in day-to-day life and guide us and mentor us. Good morning, doctor. How are you?
I'm fine. Good morning.
First of all, wishing you a very, very happy Doctors' Day, doctor.
Thank you so much.
Thank you so much for guiding us and mentoring us to lead a healthy life, doctor.
Sure. We'll start the session.
Yes. So, doctor, we are going to talk about a very common topic today, which is about sore throat, right? So, the first question which our guests want to listen, our listeners want to know is, what are the common causes of sore throat?
So, sore throat basically means that there's a pain or a discomfort in the throat. So that is what the term sore throat means. It can be because of infections. When we talk about infections, can be viral or bacterial, or sore throat can be because of ulcer disease in the stomach also. That can cause sore throat. The other very simple reason is when we use our voice for a long time, or when we sing for a long time, sometimes we call that as vocal abuse. So that can also produce sore throat. And there are so many layers in our neck. In these layers, there can be pus collection. We call it as neck abscess. In such conditions also, we can have sore throat. So that is the cause from behind. And the final and very dreadable cause, which is not very common though, cancers can also cause sore throat. So these are the causes of sore throat. Yeah.
Okay, right. And doctor, how can we differentiate between a viral and a bacterial throat infection?
So when we talk about virus catches us very fast. So for example, when we go to a crowded place, like for a vacation or something, or when we go out and drink water from a not very clean source, like a contaminated water, such things can have virus, and the virus gets into our body and causes symptoms very fast. So you can actually find out, you travel to a place and then the next day you have sore throat. That can be viral. But bacterial is mainly because of the bacteria which is there in our body, first of all, rather than coming from outside. For example, when we have a toothache or an infected tooth which is not seen properly or shown to a doctor, that can actually discharge bacteria which can go to the throat and cause infection. Or we can have sinusitis. So there is collection of infectious material in the sinuses. That all discharges in our throat, and that can cause bacterial sinusitis, bacterial sore throat. So bacterial sore throat is usually coming after some infection in our throat or tonsils or in the sinus, or if it has to come from somewhere else, like we traveled or we had some food or water, it usually occurs 5 to 7 days later. So bacterial takes a long time to multiply in our body and cause, whereas virus comes immediately. You travel one day, the next day it catches you and causes symptoms. This is the difference between viral and bacterial.
And when should a person usually see a doctor in case he has a sore throat?
So that's a very important question, I think, for all the viewers, because most of us in our place think, okay, sore throat, let me take some lozenges, let me take some warm fluids, and we'll be okay with that. I'm sure that is also right, because it is not advisable to go to a hospital for a small thing. So I would say, if the sore throat comes along with fever, or if it comes along with severe pain so that they're not able to swallow food and fluids, or if the sore throat is very bad that there is pain in their ears also, or if it comes with fever, All these things should be seen by a doctor as early as possible so that we can start them on antibiotics or antiviral drugs for them to become better faster.
Okay, understood. Right. And what are the treatment options for sore throat?
So I will start from the basic at-home remedies, like what I said in the previous question. We can take warm fluids, but please not hot fluids. Hot is bad for a red throat. So sore throat means there is infection in our skin of the throat, which is already pinkish or red. So we should not pour more and more hot, which is going to cause it worse. Warm fluids, lozenges, and taking bland food. I would say a person with sore throat should consume less spicy, less oily food, preferably at home cooked food, for the throat to become better. So that can be done, or else with all these, if it is not coming down, then we have to go to the doctor and get antibiotics.
Okay, okay. Ma'am, a listener has asked us a question, Miss Subi. She says, are lozenges safe to use during pregnancy if a woman gets sore throat?
Yeah, so lozenges are very safe to use during pregnancy, but I would say until you're 20 weeks, please do not consume more than one a day, because lozenges does not have a bad drug, but if you are having the tendency to get diabetes, all the lozenges nowadays have super increased amount of sugar, so that might trigger your diabetes during pregnancy. Otherwise, lozenges are safe, especially after 20 weeks, they are safer to use.
Okay, right. So that was also my next question in terms of understanding, can throat lozenges help us with sore throat?
Yeah, lozenges help to a level that the basic action is they soothe our throat to reduce the pain with the menthol and everything. That's all. It is not going to cure. It will only give a temporary symptomatic relief.
Right, right. And typically, how long does it take, doctor, for a sore throat to heal?
I think there is a joke which I have heard, which is commonly happening here, because they say the old grandmothers at home. So when we take, when we have sore throat and then we go to the doctor and get medicines for 7 days. So they usually say, you keep quiet at home, you will be all right in 7 days. You take medicines, you will be all right in 7 days. So it is 7 days. 7 days is the cutoff for actually our body to push out the virus or bacteria. It can do it itself, or when we give drug also, it will happen in 7 days. So 7 days is the period. But if this is only sore throat, if I was talking about other conditions like the abscess I was mentioning earlier, that will not come down. So that things should be, we should be aware. If it is more than 7 days with or without medication, it has to be brought to the notice of a doctor.
Correct. Understood. And can allergies cause sore throat, doctor? Like you mentioned earlier.
I would not say allergies causing sore throat, but they cause itchy throat. So allergy causes itching of the nose, itching of the eyes, itching of the ears, as well the throat. So they can have this itchy sensation, and the fluid coming from the nose will also go through the throat. So they can have the itchy sensation and frequent throat clearing. They keep doing this like that. They keep doing it. So all these can happen, but not pain exactly.
Okay, right, right. So, what are the common symptoms of tonsillitis, doctor?
So the tonsillitis is one of the causes of sore throat. So when I say tonsil, these are small tissue bulbs which are in the back of our throat. They are 2 in number, 1 on each sides. Usually the kids develop tonsillitis, and sometimes the adults also can develop. So tonsillitis is a little dramatic than sore throat. It is not only sore throat, they have pain, at rest, they have pain during swallowing, and then sometimes they cannot even swallow because the tonsils are bigger and they are obstructing the passage for food, and sometimes they can have difficulty in breathing also. And if the tonsillitis is acute, they can have a very high grade fever. So there is fever, pain in the throat, pain during swallowing, and breathing difficulty.
Understood. Okay. And let's say a person is having tonsils. Does he need to have the tonsils removed if he has a recurring tonsillitis?
So we have a criteria when we say recurring or chronic tonsillitis. If the patient develops 7 episodes of throat pain, fever combination in a year, or if there is more than 5 episodes in a year for 2 years, or 3 episodes every year for more than 3 years, it is advisable to remove the tonsils. Or if the patient is a child or an adult who has missed more than 2 weeks of work or school time in a year because of tonsillitis, we would advise to remove them. This is the criteria.
Understood, doctor. Understood. So we have a question coming in from a listener, doctor. Mr. Selva, he says that whenever the climate changes, I get sore throat early in the morning. I gargle with salt and warm water. The symptoms relieve, but next day morning, I get it back again for at least 3 days. Then it kind of settles. So, what is the remedy for that?
This is most likely due to a allergy episode. So whenever the climate changes, the weather changes, so the allergy in our body gets triggered, and then it causes the discomfort. So such episodes are mostly seen in allergy. Otherwise, without an external bacteria or virus getting into our body, without that we will not have an infection. But allergy is the one which is causing the seasonal allergy, we call it as. There's a lot of changes that are happening in your respiratory system, which includes our nose, throat, and the lungs. So some such people who are more sensitive during the allergy season, they can have such symptoms. They should actually see a doctor and take a long-term course of anti-allergy medications along with some nasal sprays. That will relieve actually.
Understood, doctor. Now, doctors, what are the typical risk factors for developing tonsil stones, and how can they be treated?
So tonsil stones are very simple. Basically, we are thinking it is stone. It's basically the hardened calcium, which is from our food that we take through the mouth. So it usually happens in the small kids. Whoever has a habit of not chewing the food properly, or they just swallow it in front of the parents or the teachers to get the food fast going in. So such times, the food particles, they get accumulated in the tonsils over the tonsils. The tonsils are not very smooth. They have small dips on them. So in the dips, the food goes and stays inside, and eventually it becomes a hardened calcium, and that is what we call as calcium stones. So I would advise that there is no risk factor for anyone developing, but whoever is not chewing well, not taking adequate fluids immediately after food intake, can develop tonsil stones.
Okay. And doctor, can acid reflux cause a sore throat?
Yes, that is a very common cause of sore throat nowadays. I think acid reflux is there in almost all the ages nowadays. It can be because of stress or our food intake or this increased junk food intake recently. Everything induces this acid release from our stomach. So when we have such problem in the stomach and then we lie flat in the night, all the acid comes into contact your throat the entire night. For example, we sleep for 8 hours. All this acid from our stomach stands next to our throat the entire night. So morning when we wake up, we have severe throat burning, throat itching, and sometimes throat pain also. So acid reflux is the most common cause of sore throat nowadays.
Right. So we have a question coming in from a listener, Miss Shankar Bhuvneshwari. She says, I got tonsillitis when I was a kid and settles with medication. Will I get it back again in my lifetime? I often get throat infection whenever I visit new places.
So the visiting new places and getting throat pain can be because of the throat and not because of the tonsils, first of all. And most of us would have had tonsillitis when we were kid. Usually the tonsils, they become smaller in size. We call it atrophy, which means they shrink in size when we become adults. We adults don't need tonsil function anymore because tonsils give a lot of immunity when we are kids. So when we become big, that function is taken over by many other organs in our body. So tonsils action comes down, so they become small. So the chance of getting tonsillitis when we are an adult is very, very less. Very less.
Right. And there is another question coming in from Mr. Arun. He says, hi ma'am, whenever I clean my whole home. Next day morning, I start getting sneeze and eyes become red. We usually, just a second, we usually follow entire cleaning every week, but still I'm getting that. Any tips for me?
So that is classically allergy. So this, I think we were giving a talk about this maybe a month or 3 weeks back. We were talking
Yeah,
extensively about allergy, I think for 2-3 sittings. So
correct.
allergy is what you exactly have. This has to be shown to a doctor, and you have to be started on anti-allergy medications, and that will
Right.
definitely bring you down. One tip I will give you, which is not related to today's talk also, whenever you clean, I feel prevention is always better than you getting the symptoms and getting going for a cure. Always try to wear cloth mask. Cloth mask
Yes.
will not let the fine dust particles get into your nose. So if you're not getting anything into your nose, all the symptoms will not come. This has to be done.
Correct. Right. Rightly shared, doctor. Thank you so much for that. And doctor, then uh, what are the signs for a strep throat infection, doctor, and how is
So
it treated?
okay, so for all the people who are listening, I will say strep is nothing but streptococcus. Is one of the bacteria which is there in our mouth. They normally live in our mouth, but then they turn into enemies when our immunity comes down, or when we have other infection. They start acting as if they are not our normal friends, and then they start giving infection. So streptococcus is the most common bacteria. Such bacterial infection in our throat can cause pricking throat pain, and throat redness. Again, the same what I said earlier. Even when we are swallowing our own saliva, there is pain, and there's difficulty in swallowing other fluids or foods. And then sometimes we can have small nodes here. If the infection is bacterial, there is small node here which is enlarged during the sore throat. All this can be caused, and we can also have ear pain.
Understood, doctor.
These are the
Right.
streptococcal symptoms.
And how can one prevent getting a sore throat after singing or speaking for extended periods of time?
Okay, so I would say for teachers and singers who their profession is
Yeah.
basically raising their voice and singing, or shouting, or raising their voice for long periods of time, I would say when they come back home after their work, it is better to get voice rest. Voice rest is absolutely you're not talking for the rest of the day, and taking warm fluids, and sometimes they might need anti-reflux medications also to put the reflex down, which can more aggravate this already their current condition. And they have to take less spicy and less oily food, which is not irritating the already tired throat.
Right, right. And doctor, we have a question coming in from a listener who says, if I get throat infection often, does it mean that my immune system is weak?
Your throat infection can be, your often throat infection can be because of allergy, for which I think I need more details from you to say that. But I would say immunity related throat pain is an entire different entity, because when we are talking about less immunity, that can happen in elderly patients, diabetics, or people who have already some amount of cancer or something else happening in their body for which they are taking strong drugs for a long time. For them, the immunity is down. So for such people, if there is frequent sore throat, then that has to be noted. But for people who
Okay.
does not have this all the above said problems, frequent sore throat is most commonly because of virus or because of allergy.
Understood. Understood. Frequent sore throat is basically because of virus or allergy, right? Okay. Now, can acid reflux, doctor, can cause long-term damage to the throat? Is it
Yes,
possible?
definitely. So, long-term acid reflux. So the acid is coming and getting exposed to the part of the throat, generally which do not have such exposure. So it changes the lining. It becomes more redder, more firmer. So, and then they have this sensation, irritation of the throat, where they frequently have throat clearing, or they have burning. And not only that, the vocal cords, the voice box that I say, we have two V-shaped strands that move like this whenever we talk. So these strands get affected with acid and our voice completely changes. It becomes more hoarse. So all the damage can happen if you're not noticing this acid reflux for a long time.
Right, right, right. And in general, what are the treatment options available for chronic laryngitis?
So larynx is the one which I said that is voice box, and when there is infection there, the first and foremost thing is we have to take anti-reflux medications because we should not let the acid cause more damage to them. Then voice rest, then antibiotics. Then usually this pharyngitis is the one which is the upper throat pain, and laryngitis is the one which is here, that is lower throat. So this one heals within a week, but that takes around 3 to 4 weeks for our voice to come back to normal. So it needs a prolonged treatment and patience to treat laryngitis.
Right. And then warm water can help in that, doctor?
Warm water doesn't help much there because, as I said, this is a downmost throat where our food will not go. So it's only basically medications, voice rest, things like that.
Understood, doctor. Understood. Yeah. So now, how can we prevent getting a sore throat in general, and especially when we are traveling to areas with different climates?
So whenever we travel outside, what we get exposed is the virus. So we go to a crowded area, and there is a lot of people around, and everybody has come from a different place, and they can carry different virus or bacteria. In such places, when we breathe, somebody sneezes next to us, and they discharge around 1,000 virus from their body, and then we are in the same place, we are inhaling the same air. So traveling out, I would say it is difficult to protect yourself from such trivial viral infections. The only thing you can do is you can wear a mask around, but I think that will ruin your the enjoyment mood. I think nowadays, since we are not having COVID a lot, nobody uses mask. But if at all, you have to be extremely careful when you are traveling outside. Mask is the best option because nothing will enter your nose or the mouth if you are not wearing anything. The other thing is be mindful of whatever water you are having. Better to take bottled waters, or if you don't have, please boil and cool and drink the water. These are the options you can prevent yourself from.
Understood. So bottled water and mask are two single important factors which can help you getting, avoid these things, as in climatic change infections. So what are the common causes of hoarseness, doctor, and when should I be concerned about it?
So hoarseness of voice, like I said, if the patient has a sore throat, then they can have hoarse voice. That will be all right within 7 days with or without medications. But if the patient has laryngitis, which is infection down where we speak, that takes for a long time, 3 weeks. And then sometimes it happens in teachers because they keep talking for a long periods of long hours in a day for a long duration. Sometimes there are teachers who work for 40 years in their life. And then at the end of 40 years, their voice completely changes because they overuse, they have to shout to a large population there. So they raise their voice, they strain their vocal cords. So they can have such things. All these are the most common cause of hoarseness. And the most dreadable one is the voice box larynx cancer can also cause hoarseness, but that will be worsening over time. It never improves. So whatever medication, whatever we do, if the hoarseness is not becoming better and persistently progressing to a worse place, then it is better to attend to a doctor. And it is more commonly in people who smoke. So if anybody is smoking and they have hoarseness of voice, better to see a doctor and do an endoscopic examination of your larynx before it gets worse.
Understood, doctor. So we have a question coming in from a listener, doctor, Miss Subi, who says, my sister works as a teacher. Her voice was soft and now it's hard. How can she take care of her voice? Her profession requires voice. In her profession, voice rest is impossible. Any home remedies for her?
So again, I'm saying before remedy, there has to be prevention. So there are many other things than voice rest. Like there are precautions. We call it as vocal hygiene. So we talk to the school population and ask them to come closer to us. Like if there are 10 rows of benches, make them like 5 rows and ask them to come closer to you so that you don't have to raise your voice to the last of the crowd. That is one.
Correct.
And make the people or the children quiet, because if they are making noise, then you have to raise your voice more and more and more to reach above them to actually be heard. So you have to make the children quiet before you start talking by any other means. All that. And then when they come back home, maybe warm fluids might help temporarily. That is only symptomatic relief. But raising their voice and coming back and home having voice rest is the only way to actually reduce the incidence of hoarseness in professional people like teachers.
Wonderful, wonderful. I'm sure that is of great help for all the teachers and everyone who's in profession of talking, let's say retail salesperson also, who has to speak to multiple audiences coming to their stores as well. Right. So thank you so much, Doctor. It has been a great session, very insightful. I'm sure great help to everyone. Once again, a very happy Doctor's Day to you and to all the doctors who are listening to us right now. Guys, we have been growing very fast at Curica. Do check out www.curica.com and visit to our store in Indiranagar, Bangalore. If you get a chance, you are in Bangalore. Do visit our store at 12th May in Indiranagar. We are just behind the ICICI Bank. With this, I would like to thank you and wish you all the best, Doctor, and have a great weekend.
Thank you. Thank you.
Thank you, Doctor.